So we've got about 50 attendees logging on. We'll give it another 2 or 3 minutes for everybody to log on, and then I'll start the presentation. All right, I think we're going to go ahead and start. Good morning, everybody, or good afternoon if you're on the East Coast. I'd like to welcome everybody to the second presentation of the AZNHA, Arizona In-Home Care Association Conference Series. Thanks for joining us today. You've all been muted to avoid noise disruptions during this session. We want to thank our conference presentation series sponsor, SANdata, for supporting AZNHA and this. We're going to go ahead and do Sal Sparacino, SANdata's Vice of Provider Sales. He's here to share information about SANdata. He's going to go ahead and pass this off to Sal. If you're ready, go ahead.
Great. Thank you very much. Good afternoon, or well, afternoon for me out in the New York area. I guess more of a morning for you guys. But thank you for inviting me and giving me a couple of minutes to say hello and to talk to the participants. So again, Sal Sparacino, SANdata. I handle the Arizona territory. I've been very involved in the mandate that's been going on out there that everybody knows about. We are the EVV vendor of choice for the state, and I just wanted to give you guys a little bit of an update about us, who we are, what we do, because there's more to us than just the product that you've seen the state show for our solution. We do a lot more than just the EVV and the scheduling piece of it. We have been in business for over 40 years, and we've focused solely on the home care technology business. We've also got experience with the 15 state Medicaid agencies and 8 MCOs that we're doing. We are currently the only EVV solution with CMS certification, and we are also one of the vendors with experience with all of the 4 different state EVV models that are out there. We've got 250 employees that are dedicated to the home care market. That includes both development people, support to people, and people like myself out there selling the solution. We do over 150 million transactions per year. We got over 3,000 clients in the U.S., and we manage over 1.3 million patients. So we do roughly a daily reach of about 400,000 plus homes each and every day. Some of the solutions that we have that you're probably more understanding of is our back-end solution, which is our SANdata agency management solution and our SANdata electronic EVV product, along with our mobile app to do your check-in and check-out. So our SANdata agency management system, that is our back office or our referral to cash system, agency management for Medicaid, Medicare. We also do private duty, and we do facility staffing. The EVV product is both either a telephony product, it's a mobile app which uses GPS, or it could utilize a fixed visit device if you don't have the ability for a home phone or if you don't have a cell phone that you're using. It also is integrated with all the task reporting and the point of care that needs to be done. We've got also the mobile app, which also gives you the capability of doing your check-in with the GPS, And then we've got another product, which is our Care Connect solution that gives you the ability of using the mobile app to send out open shifts to your caregivers so that they have the ability to be able to say whether or not they're available for a shift. So you don't have to sit there and be on the phone constantly calling up your caregivers and getting them to open up for a shift or try to figure out who's available for it. Some of the core features that we've got with our agency management system is our client and staff management, the authorizations that come into it. We also do HR compliance, plan of care, full scheduling. It's integrated within our EVV system. We also do your billing. We do payroll calculations and a payroll export out of it to feed a payroll solution, or you can use the payroll solution that we have that's built with a link into our product, which is called PayPro. And we also have a direct data feed to the state aggregator. So it's not, you're not losing any of the functionality of the product because of the fact that we would just go straight through the aggregator as opposed to the way you guys are doing it today if you're using it for the state program. We support both Medicaid, Medicare, and private duty. And I think I've talked enough. Hopefully everybody's still awake and didn't fall asleep. If anybody has any questions, I am more than happy to answer them for you, or you can send me an email. And my email address, I'll probably just give it to you, maybe easier. I don't know if it's availability that you could give it to them at the end of the meetings or send out an email. But my email address is S as in Sam, S as in Sam, P as in Peter, ARACINO@sandata.com. Thank you very much, and thank you for the opportunity.
Thanks, Sal. I put your email in the chat for everybody so they can get that.
Great. Thank you very much.
Yeah, thanks for the information. It's very important with the CMS mandates coming down the pipe very quickly. I think a lot of Medicaid providers are familiar with you, but I think you covered everything even in more detail than some might know. So thank you for that. And
Great,
also
thank you.
very, very much appreciate you sponsoring and being flexible with us to extend your sponsorship from our normal conference to this conference series. So we appreciate you guys supporting us.
You're welcome.
Thank you. There's going to be a quick, short question and answer session at the end of the presentation. Home Care Pulse has a person who will respond to questions as they come in on the question and answer panel on your screen. Next, I'm going to present Evan Westensee. Hopefully I said that right. He's the Senior Account Executive with Home Care Pulse. He has a background in business-to-business sales and marketing. Evan brings forward-thinking technology approaches to his conversations with home care agency owners and lets the data do most of the talking. Evan, I'll turn the program over to you.
Thanks, Caffrey. Appreciate the intro there. We're really excited here at Home Care Pulse to be partnered with the AZNHA and to be involved there. It's a great time to be in home care, and more specifically here, as the years go on, we're getting more granular in some of the data we're collecting, most specifically today for the state of Arizona. So I'm excited to be able to relay, some of that data to you guys and show you some of those results. So if those of you who don't know, Home Care Pulse has recently merged with a caregiver training company. So we are now fully merged with In the Know Caregiver Training. They provide an e-learning platform to, especially among a pandemic, a lot of people, as we'll see through the presentation today, are turning to more of a digital approach to training their caregivers and really avoiding that interaction human element to avoid the spread. And not only that, though, aside from COVID and some of the transitions as a result of COVID-19, a lot of people are realizing that it's not just for that, but also it's just easier, more convenient for the caregivers, more cost efficient overall. And so that is a great platform. We're very excited to continue with that going forward, along with our base Home Care Pulse offering of experience surveys. We always like to cover this in all of our webinars to clarify that we do two kinds of surveys. First and foremost are experience surveys. We work specifically with individual agencies to provide data from the clients and caregivers. Now, those are currently being conducted via telephone. So we're having verbal conversations with clients and caregivers on your agency's behalf to provide as a third party to get their honest feedback and to provide you with those completed surveys. It's experience data. We have 5 different metrics we benchmark. So we'll take that data and benchmark it versus other agencies in your region across the United States as an industry as a whole. It's ongoing, so every month we're doing those surveys. Depending on the size of your agency, will depend on the number of surveys. And then it comes with a monthly cost, almost as a SaaS format, if you will, or software as a service. The other kind of survey, which most people are probably familiar with already, is our benchmark study. Been doing this for a number of years. We provide data from agency owners. So agency owners are doing this survey. It's operational data. It's a one-time annual publication, one-time purchase, and really just covers, from an industry standpoint, some high-level metrics that are really important to the health of the overall home care industry. A little more about In the Know caregiver training. They provide 170 plus continued education courses that are approved in all states. This is really important here, is we don't put anything in that platform that has not been approved or that will not provide any legitimate credit. We offer courses in Spanish, which is really nice to have as far as checking boxes of compliance at the very least. And then just most recently, we got 8 courses approved by the Alzheimer's Association. So we're taking some strides there. When we're talking about the quality of caregiver training, the content within the Know is really unmatched. Really a fantastic platform. Highly recommend looking into that. Our partnership with the AZNHA has been fantastic up to this point. Again, we're very excited to work together to really strategize going forward. And as a part of this, as AZNHA members, most people on should be members of the AZNHA. If you're not, highly recommend partnering with them, especially right now. We can take as many strategic partnerships as possible, especially with the pandemic, to be able to bounce ideas off each other. Really nice to have that resource. But for those that are members, you do absolutely get some excellent benefits, service discounts, the state benchmarking report for free. So the Arizona specific benchmark report, and then free resources. So the discounts can be found right here on the experience surveys and or the caregiver training. So those members will be taken care of with that discount. And again, if you guys have any questions about, well, how do I become a member of the AZNHA, absolutely reach out to, Kefri, Zach. They'll have more info for you, and then go from there. So specifically for today's webinar, what we're going to cover is some really exciting things that are relevant to today with what's happening over the last couple months here and what's going to happen going forward. So first and foremost, we'll hit on the underused growth levers. What is the low-hanging fruit for growth? We'll cover that. Agency staffing is becoming challenging. People are not coming to work because of unemployment checks, et cetera, et cetera. Caregiver turnover goes right along with that. What's next? We did a survey with a bunch of agencies to identify what agencies are planning for the future. And then again, we'll wrap up with that Q&A session there. So growing an agency in 2020, what is that low-hanging fruit? Let's get to it. Referral sources. That is a huge, low-hanging fruit if you're not already hitting on that. We wanted to highlight the top 5 referral sources for the previous year here. First and foremost, for the state of Arizona, I want to highlight that this is not industry data. This is Arizona data. So keep this in mind. This is your neck of the woods here. The top 5 referral sources. Number 1 is clients. Numbers 2, 3, and 5, we're going to see as healthcare professionals. Number 2 is going to be skilled nursing facilities. Number 3 is going to be hospital discharge planners. And then the 5th is going to be assisted living facilities. So really interesting to see where those referrals are coming from. From my experience, clients tend to be the most quality referrals just because they know somebody, having that relationship factor in there is really important. And then the 4th one here is networking. So business networking groups, that could be joining whatever other network is in your area there. So those are low-hanging fruits for the referral sources there for your specific state. Percentage of revenue by payer source. There's a lot of numbers here. There's a lot of payer sources listed. We'll highlight a couple of areas here for the state of Arizona. Private pay is about 53.8%. Long-term care insurance actually comes in at an astounding 19.3% compared to 11% for the region and the industry. Medicaid waiver programs becoming more relevant as time goes on. 10% for the state of Arizona, which is significantly higher than the industry and region. So again, if this is being recorded today, highly recommend going back and looking through some of these slides and identifying some of these more detailed metrics here. Also want to highlight the industry masters that we see here on the right in the purple. Those are that column is referring to agencies that do 5 million plus in revenue annually. So that's going to be the industry masters group that the comparison is being made there. The client average length of service for the previous year, the state of Arizona here is going to be 17 months. That's the average length of service compared to the industry at 12, and then the industry masters here at 16 months. So Arizona is coming in at a very strong number here for length of service. The average lifetime value doesn't quite correlate with that. As we go back here, we see 17 months for the state of Arizona. The industry is at 12 months. However, the average lifetime value is about the same for the home care industry. So pretty positive overall, I'd say, generally speaking, with this feedback for the state of Arizona. And then industry masters, those larger agencies coming in at 26,000. Again, this page right here, we're pulling directly from our benchmark study. So if you're wondering what's in the benchmark study, it's statistics just like this and metrics that we cover very similar to this. There really are 3 main ways, or I guess 3 only ways to increase revenue when you look at the structure of home care agencies. The first is to get more clients, right? To just up that volume. The second is to make more money per client. As we saw those last 2 graphs covered those. And then also just retain clients longer. Those are the 3 main areas we can really focus on when we talk about key profit drivers. So definitely if you're not focusing, on any of those yet, you should be. If you're not, I highly recommend it. Let's get into agency admin staffing. What are the trends? How can agencies staff efficiently? We're facing a lot of really complex situations right now amid this pandemic. So let's take a look at some of these points. We wanted to first highlight the median number of office staff in 2019. So for the previous year, we look at the state of Arizona and compare it to the industry masters and the industry and region. Not too crazy here. It's pretty self-explanatory, but the median number of office staff for Arizona is 8 for the previous year, as opposed to the industry at 6, and then the region at 6 as well. The turnover, as we look at office staff specifically, now this is not caregiver turnover, this is office staff turnover in 2019. The state of Arizona is at 14%. The industry is at a whole 4th, at 25% there, right on par with the region. So we're seeing a little bit lower turnover for the office staff in the state of Arizona, even lower than the industry masters across the nation. So pretty significant there. We're going to take a look at office staff salaries as well. A lot of times we have to think, is there a sweet spot? How do we compare? What should we pay our office staff? Here's a really good, starting point to go off of when you think about that. As we look through these different positions, we can see how the state of Arizona compares to the region, the industry as a whole, and then if as a larger agency, it's really good to have that master's comparison as well. So this again is pretty self-explanatory, and highly recommend checking this out and really doing analysis with your finance team to see where that sweet spot is for your specific agency. As we kind of take a step back here and look at the pandemic, COVID-19, 51% of agencies report that they're considering remote options for office staff. So really creating a shift, not just in home care, but as a world, right? We're seeing a shift. We're on a Zoom meeting today. There's conferences that were canceled for the fall because of this. So there's a lot of shifts going more digital. And so over half of agencies report they're making it more of a permanent situation to provide remote options for the office staff beyond, the pandemic. Caregiver turnover. This seems to always be, since I started in home care a few years back, this seems to be a common occurrence. Caregiver turnover, when we look at those key profit drivers, retention is huge. So caregiver turnover is something to look at here. Is it going up or down? What should agencies expect for the future? Let's dive in. The previous year here, caregiver turnover rates in the state of Arizona, 58.1%. That has gone down from the previous year. So really interesting there. Home care industry as a whole has also gone down. It's down to 64.3%. Last year, we were looking in the 80s at turnover. So that's a positive sign. The region is still right around that 81% mark. And then the industry master is 62%. So the state of Arizona, according to these data points, is doing a fantastic job at retention. The median hourly caregiver pay for the previous year. It looks like the state of Arizona generally is paying more per hour to these caregivers than the home care industry as a whole, and then also a little bit more than the region, almost $1 more in most cases here, 50 cents to $1 more per hour. So really interesting to analyze, take a step back, compare your agency with this, and see where you guys land. I do want to say as well, I have seen a few interesting cases when we talk about caregiver pay. It's not necessarily the more you pay, the more likely they are to be retained or to stay with your agency. There definitely is a sweet spot within there. So highly recommend thinking about what that sweet spot is and use this data to come to that conclusion. We wanted to also do a very high level survey across the nation. This data we've compiled is going to take a look at the caregiver satisfaction scores across the board. So over 72,000 satisfaction surveys with specifically caregivers. This is where we're getting this data from. As we can see from 2018 to 2019, the overall caregiver satisfaction has gone up fairly significantly across all of the metrics that we're measuring. So positive signs for agencies across the board. It looks like the proper protocols are being taken and agencies really are improving that caregiver satisfaction. Another high-level question we asked was what attracted these caregivers to the profession? Why are people wanting to be caregivers? Again, looking at retention and turnover, this is crucial to know. Just high level, why most people are, wanting to become caregivers. First and foremost, which our gut probably told us this, is because they have a desire to help people. The data confirms it. 88.3% said it's for a desire to help people. And then a couple other popular answers were it's the first step to becoming a nurse. I'm sure a lot of agencies will happily take someone that's looking to expand their knowledge within giving care. And then the hours of the job. So just flexibility there is common for a lot of people. 9% was able to get hired without training or experience. We've always got a couple of those. And then 8% said the pay, so the salary. Really interesting statistics here just to glaze over and think about. Now the fun begins. What's on the horizon for home care agencies? What's everybody thinking? What's going through owners' minds? Where are we headed? COVID-19 has brought some fun and interesting shifts, again, not just to home care, but really the world. And so how has that impacted us specifically here in home care? These are innovations that agencies have implemented currently and that plan to continue even after things return to normal. 44% of agencies, owner administrator working from home. 51% wanted to have staff members working from home. 25% implemented telehealth and plan to continue with that. I think the word that really comes to mind when I think about a lot of these shifts is just convenience. I mean, you look at Amazon, people are shopping on Amazon because it's so dang convenient. I can click a button and it will be on my doorstep the next day. It's pretty incredible to think about that. And so when we think about convenience and flexibility and doing a job, what we've seen is that as the shift to more of a virtual world happens, owner administrators working from home, it doesn't seem to have that big of an effect on the overall trajectory of the agency. And so in some cases, it's been more of a positive effect by allowing this online approach. Online caregiver training as well, that's no different. 41% of agencies are planning to continue with this form going forward. In the Know, for example, online e-learning platform makes it available not just on the computer for the caregivers to complete trainings, but on their smartphones as well. And then finally, non-traditional visit format. So a virtual visit, grocery drop-offs, things of being more cautious with that interaction. Looking forward, the top 3 threats facing home care providers in 2020, caregiver shortages above and beyond, not just for the state of Arizona that I've seen, but just about every state we're working with is caregiver shortage. That's the #1 threat. Number 2 is for the state of Arizona, fight off the $15 wage battle. So the increase in minimum wage is creating a bit of a difficulty for agencies to really attract people to come work for them. And then finally, attracting enough referrals. So a lot of this goes hand in hand and is related. So really interesting. What we asked to get this information was specifically, what do you see as the top 3 threats to the future of growth? So pretty straightforward there. Caregiver shortages, the minimum wage battle, and then attracting enough referrals. If you're wondering, what can I do to attract more referrals? Again, we have a lot of resources. I know the AZNHA has a lot of good resources for that. A lot of really good contacts to get in touch with there and to bounce ideas off of. And then Home Care Pulse as well has a plethora of free resources and then also services to really help with a lot of these areas. We want to take a look as well at the percentage of providers tracking hospital readmission rates. So who's tracking those readmission rates for the previous year? For the state, only 14% of Arizona agencies are tracking that readmission rate, 86% not tracking it. The industry, about a fourth of the industry as a whole is tracking readmission rates. And then for the region, it's right around that 20% mark. Industry masters, so the larger agencies, I don't think that's a coincidence, but 33%, so a whole third of those larger agencies are tracking readmission rates. Interesting statistics to look at and to consider there. Top 3 growth opportunities in 2020. We covered this a little earlier as far as that low-hanging fruit. And really it's to just continue off of that here is first and foremost, strengthening relationships with those current referral sources that you already do have. How can you do that? Great question. Love to have a conversation another time to get into the weeds on that and those details. There's a lot of good stuff with strengthening relationships. That all ties back to getting client and caregiver data and really leveraging data to strengthen that relationship. Caregiver recruitment and retention programs is number 2. Great opportunity there. Again, what better way to really improve, grow, or increase profits and improve your agency than to just retain the current people you have and better the individuals you currently do have. And also the caregiver recruitment program to increase that as well. And then offering of other service lines. So third, expanding the horizons with what you're currently offering. Those are the top 3 growth opportunities for your guys' specific neck of the woods in Arizona. We asked the survey participants in this particular survey across the industry were asked, which of the following do you anticipate doing in the next 5 years? So what is going through the minds of other agency owners? Where is home care headed? What's everyone thinking? The number 1 and most popular answer here was they planned on holding and growing. So 59% of agencies said they plan on holding and growing. Other owners planned on adding another location. Almost 40% planned on adding another location. 18% planned on acquiring another agency. We're seeing a lot of acquisitions happening right now. Selling your agency, so 16% of owners plan on selling, in the next 5 years. A good amount, 16% plan on transitioning day-to-day to other family and or employees. And then 5% had another answer there. A great highlight here is 0% planned on closing their doors. So that is a positive sign there going forward. This is the 2020 Arizona Benchmarking Report. Again, reach out to the AZNHA for a digital copy of the full 2020 state report for Arizona. And from there, again, this has about 60 data points. We've covered about 10 to 12 in our presentation today. So highly recommend getting that. It's going to be an awesome resource for you guys to reference. And then also, you're going to get a discount off of the annual study, the nationwide study for the benchmark. Again, this is 175 plus data points. There's a lot of tangible things to take from here. Both digital and hard copies are available. You'll be able to get 20% off with the code Arizona20 for all attendees for today's conference. Okay, that is it. We can now open up for a Q&A here.
Thanks, Evan. That gives us a lot to think about. And so I guess we'll open it up for a few questions. There was a few questions in the Q&A bar and the chat bar. I'm not sure if we answered all those.
Let's see here. I know we had a poll as well, Kefri, for to ask those attendees if they wanted to learn more about anything. I just opened it here. If that's okay, real quick, we can have those everyone on today at this poll. It's just going to ask if you want to learn more about Home Care Pulse or the caregiver training, the e-learning platform within the know. They have the option, to choose one or the other or both. So feel free to do that. If you guys needed any, really just if you have further questions as well, love to expand. There's no silver bullet to a lot of these issues we're facing. And so I think it warrants a further conversation in a lot of cases. I know there's a lot of more detailed questions around salary and things like that. So we can help address those in a different conversation. So I'll leave this open for a couple more seconds here on this poll.
So just to clarify, Evan, for everybody, I know it was a question earlier in your talk. Everyone's going to get a copy of this deck with all the results from the benchmark study, correct?
Yeah, and they can also get an actual copy of the full benchmark study for
not just Arizona but the country.
So they will get the Arizona one free, and for the country, they can, for the industry benchmark, that they'll get 20% off that with Arizona 20 as the code.
And then I saw that Zach posted a few questions in the chat. Do you want me to read those to you, or do you want to look at those?
Yeah, let's see here. Yeah, do you want to go ahead and read those?
Okay, the first one says, what techniques are companies utilizing to attract more referrals from past clients? That's the first question.
Yeah, from past clients. So I think a lot of when we talk about techniques and referral sources, there's no silver bullet here, but I think one of the techniques that I have seen in my personal experience, and if Zach or I guess Caffrey, if you have anything to add, feel free. Again, because there's no right answer here, right? But what I have seen as far as, getting referrals from past clients and things like that is getting their feedback and really just hearing about their experience, what went well, what didn't go well. And the happier you are, I guess the better you are at making people happy, the more likely they are to refer to you. So I think my recommendation is data talks. Data does a lot of talking, really solidifies a lot of gut feelings that we may have. So my recommendation there is, as far as a strengthening, maybe a referral source, relationship, use data. Use data to identify what makes your caregivers or clients happy. It really all ties back to data, in my opinion. Not
Next
sure.
question
Yeah.
from Zach is in regards to how are companies being reimbursed by Medicare? And is this even possible in Arizona? Do you have any answers for that?
I'm going to have to take a step back on this one. I have heard that it takes a while to get reimbursed, but that's probably, I don't want to start throwing things out there that aren't true or that aren't 100% accurate. We do have really good resources to share with you guys as far as reading material and things to look at. But for today, I would just say the only thing I've heard with that is to get reimbursed, it's taking a lot of time to get that reimbursement, and that creates a lot of challenges for agencies as far as they're expecting money but not sure when it's going to come back to be reimbursed.
My experience on that is I know for sure there's providers in Arizona that have completed contracts with at least one of the health plans in the state. So there's opportunities to build relationships with those health plans and get contracts. I don't know how to do that, but I know it's happening as we speak right now. The next question from Zach was, what is lifetime value per client? Is this billing or net?
Yeah, so for Arizona, I believe it's billed rate and not net as well. So it's billed rate. The lifetime value of a client in Arizona is 12,287.
Next question. Sorry, I got an angry French bulldog in the background. Do your reports combine Medicaid and private pay businesses, or do they separate them?
Yeah, so these two are going to be separate.
Another question is, what do you believe has contributed to the significant decrease in caregiver turnover from the previous year?
Yeah, so when we did that poll question of increasing, when we asked for the 5 metrics that we measure, we wanted to look at the focus as an industry and see how well agencies were doing at caregiver satisfaction. And as we looked at those 5 metrics, we can see that the more people focused on trying to improve their satisfaction, the turnover rates were going down. So I think a lot of that attributes to just the focus as an industry. I think a year ago, or a little over a year ago, I think we all kind of had a red flag moment of, wow, this is kind of getting out of control. And so I think as the more people focus on that, the more we're able to see, the fruits of that labor as it become a focus there.
And then there's also some more questions in the Q&A area.
Okay.
It says, please share caregiver salary again. I don't know if you can pop that deck up.
Let's see here. Caregiver salary.
Or hourly wage.
Median hourly caregiver pay here.
Sure. The next one is what other service lines are you referring to in regards to that one page you showed about
Yeah,
expanding service lines?
sure. So, I mean, you've got home health, you've got home non-medical, right? So I think when we talk about different service lines, I think that's what we're referring to as if you're strictly non-medical, maybe look at going into medical care as well with skilled nurses potentially. You know, there's a lot that comes with that, but certainly an area of potential growth or opportunity in those different lines. I think that's what that was referring to as well.
Okay. Next question. Looking at median office staff salary slide, and I would assume from other metrics showcased in the presentation, how many offices / responses are represented as quote unquote state of Arizona? Same question for home care industry, central region, and industry masters. And
Yeah.
if I heard correctly, industry masters are $5 million plus, correct? That is correct. The industry masters, that category was gross receipts of over 5 million.
That is correct. Yes. So the masters is 5 million plus. And then to answer how many offices / responses are represented as state of Arizona, we had 40 agencies in Arizona participate. So 40 Arizona agencies and 1,800 nationwide.
Okay. There's another question. Also, when you're referring to adding locations, are you referring to adding physical locations or just expanding to different areas?
Yeah, so when we refer to locations, it's typically brick and mortar setup location in a different area. I know a lot of agencies will service a broad area of different towns, but we don't consider every town of service a location, so to speak. So I would say a location would be brick and mortar.
Thanks. The next question, I can clarify this if you need clarification.
Yeah.
I guess on that, let me see. I have to scroll down. It was asking if based off the study that they did, the percentage of family caregivers in Arizona is.
That is a good
Looks
question.
like Tyler answered that, or
Let's see.
So we don't have that in the study.
Yeah, we don't have that information.
Okay. Does anyone else have any other questions that they'd like to, wait, let's see if there's more in the,
is it better to do brick and mortar? Because I see that just pop in there.
Yeah, it just popped up.
For a location, I'm assuming they're referencing. You know, I don't know the answer to that one. That's kind of a fun conversation to have. Just thinking out loud off the top of my head, I think it does have its advantages, you know, to have a team set up in that area to be able to service and really stay on top of things. But I don't know if it's better to do brick and mortar or not. I don't know if you have anything, Kefri, or experience.
Yeah, I mean, I can chime in on that. If this was 2019 or 18 or 17, I would say, of course, the caregivers prefer to be able to come. My experience is the caregivers prefer to have a home and be able to come in and connect with the staff. And if they have a problem with a client or paperwork or whatever, they want to be able to walk in whenever they feel like it. But as far as office staff in the last 6 months, they're really grabbing on to, I believe, a new expectation across the whole industry to be able to work from home completely, or in the future, maybe a hybrid type work environment where they can be on a platoon type environment where they can be in the office every other day. So I think from office staff perspective, you might not need to expand with brick and mortar, but for caregivers, I think they like that experience closer to where they're working and where they live.
Yeah, that's fantastic.
So I have a question from Amanda. It says, how many agencies are in Arizona total so we can compare with sample population?
I'm not sure. I don't think I know this one. Kefri, do you have an idea?
I could just make something up. So that would be helpful. We've got 40 people. We've got 40 providers in the survey. I've heard higher than 300 or 400. But Zach, I don't know if you want to pop in on that one. If you know, I don't think we have an exact number, but I know it's probably over 300, potentially over 400 home care providers. So we don't have a number on that. That's something we'll have to look into.
Yeah.
Let's see here. Okay, here we go. Ted Holmgren says at last count, 700 agencies in Arizona. Maybe my 300 plus was just for Maricopa County, Ted? Let's see if we have anything in the chat. I don't see anything else in the chat. Did we?
I'm not seeing anything else here.
I know earlier, I think somebody already answered it, but just for the whole group, there was a question about what was the gross earning that the salaries are based on that slide that you presented earlier.
Yeah, gross earning.
Because I know you have the $5 million plus agencies, but so that right there, those different slides or those different columns besides masters, did we have an average gross earning for those other categories?
So I believe that can be found in the Arizona benchmark, the state-specific benchmark study on page 33. We didn't include it in the slides today.
Yeah.
But great incentive, whoever asked that, or if you're interested, page 33 in the Arizona report, that can be found.
Okay.
So
I know you mentioned some, go ahead.
Oh, I was just saying, we just kind of grazed it here, and then to get a little more granular and detail, we'll include that full kind of everything in page 33 of the Arizona report.
And I know you mentioned something that you thought was interesting as far as the caregiver hourly rate, how we were almost over more than $1 over other parts of the country.
Sure.
I think that's based over the last couple of years. Our minimum wage was increased to $12 an hour.
Gotcha.
So.
Yep. That's a tough battle you guys are fighting there in Arizona for sure.
So we've got up to 5 or 10 minutes left. If anybody wants to pop up some more questions in the Q&A or the chat. Let's see, I think we've answered everything. We want to make a last call request for questions, Evan?
Yeah, I believe if you missed the poll, maybe you hopped back on here. If you missed the poll, feel free to email. I'll pull my email up here again, jot my email down. We can set up a time to chat if you need to learn more, if you have any further questions. But yeah, I think that's pretty much it. Happy to have any sort of conversation going forward with anyone about anything really. So.
Okay, I think we got one more. Does the annual report have info regarding workman's comp averages?
The annual report.
Or does the report have anything regarding workman's comp costs, I guess? Or claim, would it be number of claims or costs? I'm not sure.
So we actually don't have included in the annual report. We don't have the.
One more question. Are home care agencies participating in chronic care management and remote patient monitoring programs? That's from Jamie Flesher.
Yeah, and again, this is just from my experience.
Yeah.
But yeah, I have heard a few that, especially the remote patient monitoring programs. When I think we went through, one of the slides was some of those virtual visits.
Right.
So yeah, there's quite a few agencies doing that currently. Yes.
All right. Well, unless we get another question in the next 60 seconds, we're going to close it out. I want to really thank everybody for participating today in our second presentation series. Just a reminder that the next one in our series will be Tuesday, September 22nd, starting at the same time, 11 a.m. Our speaker will be Stephen Tweed of Leading Home, and he will be offering tips on recruiting during the COVID pandemic. Thanks again, and we'll see everybody next month. Thanks, Evan.
Thanks, guys.
All right. Thanks, everybody.